1. Fundamentals of nursing. Questions 140. Question 1. The nurse is delegating tasks to an unlicensed assistive personnel, UAP, on a surgical unit. Which tasks are appropriate to delegate? Select all that apply. A. Assisting a stable patient with ambulation to the bathroom. B. Performing a sterile catheter insertion. C. Recording vital signs for a post-op patient. D. Administering oral acetaminophen to a patient. E. Repositioning a patient with a pressure ulcer. Correct answers: A, C. E. Rationale UAPs can assist with ambulation. A. Record vital signs. C. And reposition patients. E. Within their scope. Sterile procedures. B. And medication administration. D. Require nursing licensure and judgment. Question 2. The nurse is prioritizing care for 4 patients. Which patient should be assessed first? A. A patient with a fever of 100.4 degrees Fahrenheit, requesting a blanket. B. A patient with a blood pressure of 88/52 mmHg and dizziness. C. A post-op patient with stable vital signs, requesting pain medication. D. A patient with a blood glucose of 200 mg/dl and no symptoms. Correct answer: B. A patient with a blood pressure of 88/52 mmHg and dizziness. Rationale: hypertension with symptoms suggests shock or instability, requiring immediate assessment. Fever. A. Is less urgent. Pain. C. Is routine and asymptomatic. Hyperglycemia. D. Is not immediately life-threatening. Question 3. A patient refuses a colonoscopy due to cultural beliefs about bodily invasion. What is the nurse's best response? A. Proceed with preparation to ensure compliance. B. Document the refusal and explore alternative screening options. C. Convince the patient by explaining benefits. D. Involve family to persuade the patient. Correct answer: B. Document the refusal and explore alternative screening options. Rationale: respecting autonomy requires documenting refusal and offering culturally sensitive alternatives. For example, fecal occult blood test, forcing. A. Convincing. C. Or involving family without consent. D. Violates ethics. Question 4. During a code blue, the nurse is assigned to compressions, but notices the defibrillator is malfunctioning. What is the priority action? A. Continue compressions and notify the team leader. B. Stop compressions to troubleshoot the defibrillator. C. Administer epinephrine without orders. D. Delegate equipment check to a UAP. Correct answer: A. Continue compressions and notify the team leader. Rationale: compressions maintain circulation. Notifying the leader ensures equipment issues are addressed without disrupting CPR. Stopping. B. Delays care. Administering meds. C. Is unauthorized. UAPs. D. Don't troubleshoot. Question 5. A nurse suspects neglect in an elderly patient with poor hygiene and weight loss. What is the legal obligation? A. Discuss concerns with the patient's family first. B. Report to Adult Protective Services immediately. C. Wait for physical evidence of abuse. D. Document findings and monitor over time. Correct answer: B. Report to Adult Protective Services immediately. Rationale: nurses are mandated reporters. Suspected neglect requires immediate reporting to protect the patient. Discussing with family. A. May delay. Waiting. C. Risks harm. Monitoring. D. Is insufficient. Question 6. A patient with a nasogastric tube reports nausea and abdominal distension. The nurse's first action is: A. Irrigate the tube with normal saline. B. Check tube placement and patency. C. Administer an antiemetic. D. Increase the suction pressure. Correct answer: B. Check tube placement and patency. Rationale: nausea and distension suggest obstruction or misplacement. Verifying placement. For example, pH. X-ray is priority. Irrigation. A. Follows. Antiemetics. C. Don't address cause. Increasing suction. D. Risks injury.